The story of some cancers can begin with a single cosmic messenger, a proton created in a distant supernova, traveling across the universe toward Earth. This proton embarks on a remarkable journey, speeding toward Earth at nearly the speed of light. It passes silently through the atmosphere, moving unnoticed through clouds, buildings, and even the walls of a hospital room. In a split second, it enters a human body, colliding with a single cell and striking a strand of DNA deep inside. Most of the time, the cell's repair mechanisms quickly fix the damage, but occasionally, a tiny error remains. That single, almost invisible mistake can set off a chain reaction, one that, over years, may contribute to the beginning of cancer's story. Sometimes, the most dangerous threats inside your body are the ones your immune system never detects. Picture a world beneath your skin, where immune cells constantly patrol, searching for anything out of place. When a cell is damaged or infected, it sends out distress signals. The immune system's defenders respond quickly, targeting and eliminating the threat. But sometimes, a cell undergoes a subtle mutation, so minor it escapes notice. This mutation can disable the cell's ability to send out warning signals. No alert is raised. The immune cells continue their patrol, unaware of the mutated cell in their midst. Without interference, the altered cell begins to divide, unchecked and unnoticed. With each division it produces identical copies, each carrying the same hidden mutation. Gradually, a small cluster of these cells forms, multiplying quietly. The immune system remains unaware, missing this silent accumulation. The cluster expands, preparing for what comes next. At this stage, it isn't a tumor yet, but the groundwork has been laid. The process has started. The first steps toward disease are underway. The cluster is still tiny, nearly invisible, but its potential for harm is significant. The vigilant immune system has missed this silent development. Now, the stage is set for a much larger conflict. This quiet beginning marks the onset of a hidden struggle within the body. Soon, the body will have to respond to these abnormal cells. For now, the hidden threat grows, unseen, but persistent. Deep within the body, a small cluster of abnormal cells faces a critical challenge: survival. As this hidden colony expands, its center begins to suffer. The cells at the core are deprived, isolated from essential oxygen and nutrients. Without intervention, this growth could stall and die out. But some cells adapt. They release chemical signals, growth factors that reach out to nearby blood vessels, signaling for help. The body responds, often unknowingly. Tiny, delicate blood vessels begin to grow toward the tumor, attracted by these signals. This process is called angiogenesis, the formation of new blood vessels. Now, the tumor is no longer deprived. It connects to the body's blood supply, transforming a crisis into an opportunity for further growth. Like a parasite, the cancer establishes its own supply lines, growing stronger as it receives more nutrients. What started as a single abnormal cell has now become a growing threat. The body, unaware, is now supporting its own adversary. Angiogenesis is a crucial turning point, the moment the tumor gains the ability to sustain and expand itself. With a new blood supply, the cancer can organize, multiply, and accelerate its growth, becoming increasingly dangerous. The body's own resources have been commandeered, the cancer's progression is underway, and the real battle is just beginning. Did you know that a tumor can activate a process known as the angiogenic switch, fundamentally altering its future? When this switch is turned on, the tumor signals for the growth of new blood vessels, providing it with nutrients and oxygen to support its rapid growth and invasion into surrounding healthy tissue. However, these new blood vessels are abnormal, disorganized, leaky, and very different from the body's normal structured vasculature. This disorganization leads to areas within the tumor that are deprived of oxygen, making the cancer more resistant and unpredictable. In these low-oxygen conditions, cancer cells can mutate further, adapting and becoming even more difficult to treat. The leaky blood vessels also provide pathways for cancer cells to enter the bloodstream, allowing them to spread to other parts of the body. The tumor's new blood supply essentially connects it to the rest of the body, increasing the risk of metastasis. Yet, this process also exposes a vulnerability, a dependency that doctors and scientists can target. This is where angiogenesis inhibitors come in, medications designed to block the formation of new blood vessels and cut off the tumor's supply. The aim is to starve the tumor, shrink it, and limit its ability to grow and spread. This is a key front in modern cancer therapy, where clinicians work to halt tumor progression by targeting its blood supply. In this battle, the focus is not just on the cancer cells themselves, but on controlling the very pathways that allow cancer to survive and spread. Inside your body, every cell is governed by a biological clock, a countdown to its own lifespan. This clock is located at the ends of chromosomes in protective caps called telomeres. Each time a cell divides, its telomeres become shorter. When telomeres reach a critically short length, the cell can no longer divide and either becomes inactive or dies, a natural process that limits cell lifespan. However, cancer cells bypass this limit. They reactivate an enzyme called telomerase, which rebuilds their telomeres, allowing them to divide indefinitely. As a result, cancer cells can keep dividing without aging, escaping the normal limits that keep healthy cells in check. Cancer also disables the body's natural defenses, such as the p53 gene, a crucial tumor suppressor that normally stops abnormal cell growth. With these safeguards turned off, cancer cells ignore signals to self-destruct and continue to grow uncontrollably, regardless of the body's attempts to stop them. Immortality, resistance to cell death, uncontrolled growth, and the ability to stimulate new blood vessel formation, these are some of the key hallmarks that make cancer so dangerous. Our cells are equipped with multiple layers of protection, developed over millions of years to prevent uncontrolled growth. Cancer systematically breaks down these barriers. Like a skilled intruder, cancer evades every defense, invading tissues where it does not belong. With each advance, cancer becomes more aggressive, resisting the immune system, overwhelming healthy cells and continuing to spread. The transformation is profound. What started as a single, abnormal cell, and it has become a force that can reshape entire tissues and organs. These are the hallmarks of cancer, its defining features, and the reasons behind its strength and threat to the body. Now, the struggle is not just for a single cell, but for the health of the entire body. The battle lines are drawn. Many people don't realize just how different two tumors can be. Picture two travelers embarking on very different journeys inside the human body. One is gentle, the other aggressive. The first traveler is the benign tumor. It grows slowly, quietly, and remains localized. Its cells are organized, closely resembling healthy neighbors. Like a guest who never leaves their room, this tumor is surrounded by a thin capsule, staying within its boundaries. However, even a quiet guest can cause problems if it grows large enough to press on vital structures or organs. Most often, doctors can remove this tumor surgically and the issue is resolved. The second traveler, the malignant tumor, behaves very differently. Its cells are abnormal, disorganized, and do not resemble healthy tissue. This tumor does not stay confined. It invades nearby tissues, spreading in multiple directions, much like the legs of a crab extending outward. That's why it's called cancer, from the Latin for crab, reflecting its invasive, spreading nature. The real danger arises when malignant cells break away, entering the bloodstream or lymphatic system to spread to distant organs. This process is called metastasis. Cancer cells become stowaways, traveling far from their origin to establish new tumors, turning a localized problem into a widespread disease. Suddenly, what started as a small issue can escalate into a life-threatening battle affecting the entire body. Think of benign tumors as castles, contained and easier to manage. Malignant tumors are like invading armies, spreading and disrupting normal function. The difference? One is a local issue, the other, a disease that can spread throughout the body. When cancer metastasizes, it can affect any part of the body. No area is immune. At this stage, the stakes are extremely high. Every treatment decision becomes crucial. The body faces a relentless adversary, one that continues to advance. The journey becomes a fight for survival. What's something people don't know about how cancer spreads? Imagine a single cancer cell, restless and adaptive, preparing to leave the crowded environment of its original tumor. This process is called metastasis, the point at which cancer becomes far more dangerous and difficult to treat. At some point, a cancer cell detaches from the main tumor, breaking away to survive and spread, despite the many barriers it will face. The cell navigates through the surrounding tissue, searching for a way out. Eventually, it enters a blood vessel, becoming a traveler in the body's circulatory system. The bloodstream is a hostile environment. Most cancer cells are destroyed by physical forces or the immune system, but if even one survives, it can start a new tumor elsewhere. Some cancer cells evade detection by cloaking themselves with platelets, helping them avoid the immune system as they travel to distant organs. When a cancer cell reaches a new organ, it leaves the bloodstream and enters the tissue, attempting to adapt and survive in this new environment. Most cells will not survive this transition, but those that do can begin to multiply, forming a new tumor, a metastatic site. The new tumor stimulates the growth of blood vessels, a process called angiogenesis, to supply itself with nutrients and continue growing. As this process repeats, cancer can spread to multiple organs, making treatment much more challenging. What started as a single cell's journey can become a widespread problem, affecting the entire body. Blood vessels act as highways, allowing cancer cells to travel and establish new tumors in distant locations. This ability to escape and spread is what makes metastatic cancer so dangerous and difficult to control. The body's immune system continues to fight, but metastatic cancer cells are skilled at evading defenses, leading to an ongoing struggle for survival. What's something many people may not realize about the fight against cancer? For decades, treatment relied on broad, aggressive approaches, surgery to remove tumors, chemotherapy to attack rapidly dividing cells throughout the body, and radiation to target cancerous areas. These methods have saved countless lives, but they can also cause significant side effects and lasting impacts. Today, we are entering a new era, one defined by precision medicine, where scientific advances and patient-centered care come together. Doctors can now analyze the genetic makeup of each tumor, uncovering mutations and molecular features unique to every patient's cancer. This information allows for treatments tailored to the individual rather than a one-size-fits-all approach. For example, not all lung cancers are the same. By understanding the genetic differences, doctors can select therapies that are most likely to be effective for each patient. Targeted therapies are designed to interfere with specific molecules involved in cancer growth and progression. These drugs can be more effective and often have fewer side effects than traditional chemotherapy. Artificial intelligence and advanced computing now help analyze vast amounts of medical data, supporting doctors in making more informed, personalized treatment decisions. Another major advance is immunotherapy, treatments that stimulate the patient's own immune system to recognize and attack cancer cells. Medicines called checkpoint inhibitors help the immune system identify cancer cells as threats, unleashing a more powerful immune response. With these advances, the body's own defenses can play a central role in fighting cancer, sometimes leading to long-lasting remissions. Precision medicine is transforming cancer care, making treatments more targeted, less invasive, and more effective. The outlook for patients is improving. Treatments are becoming more personalized, with better outcomes and improved quality of life. We are at the forefront of a new era in cancer care, one marked by innovation, collaboration, and hope. The dawn of precision medicine is here, bringing new hope and possibilities for patients and families everywhere. Imagine entering an operating room where technology and human skill work seamlessly together. Here, the surgeon's hands are supported by advanced robotic systems, enhancing precision and control. In today's surgical suites, robotic systems act as precise extensions of the surgeon, translating their movements into highly accurate actions. The surgeon operates from a specialized console, using hand controls and a 3D monitor to guide the robotic instruments inside the patient's body. Every movement is scaled and filtered by the robotic system, eliminating tremors and allowing for steady, precise maneuvers. Miniaturized instruments can access areas that are difficult or impossible for human hands, enabling minimally invasive procedures. With smaller incisions, patients experience less pain, reduce blood loss, and often recover more quickly than with traditional surgery. Robotic assistance helps preserve healthy tissue and protect vital structures, making surgery safer and more effective. This collaboration combines the surgeon's expertise with the robot's precision, working together for the best patient outcomes. Tumors can be removed with remarkable accuracy, minimizing damage to surrounding healthy tissue and improving recovery prospects. The future of surgery is here, offering patients safer procedures, faster healing, and renewed hope for recovery.